We have 21 new cases of COVID-19 in BC. That includes 18 people who tested positive and 3 epidemiologically linked cases. That brings our total of people with COVID-19 to 3,170 in British Columbia, including 1,028 people in the Vancouver Coastal Health Region, 1,667 in the Fraser Health Region, 136 people on Vancouver Island Health Region, 223 people in the Interior Health Region, 65 people in Northern Health, and 51 people who live outside of Canada. We have no new healthcare related outbreaks, but 3 active ones that are ongoing, 2 in long-term care and 1 in acute care. We are now up to 655 people in long-term care, assisted living or acute care who've had COVID-19, including 400 residents and 255 staff. We have no new active community outbreaks other than the ones that we've reported on this week. We now have 4 cases related to the Crazy Cherry Farm. And we have continuing with contact tracing and trying to determine the number of people related to the community exposures events in Kelowna. There are 27 cases now associated with those exposure events, 18 of whom live in the Interior Health Region and 9 people in Vancouver Coastal Fraser Health Regions. I do want to remind people that if you have been at one of the locations within a community exposure event, you do need to monitor carefully for symptoms, limit your contact with others through this incubation period, and contact 811 if you have any symptoms at all to arrange testing for COVID-19. We have 192 active cases right now, of whom 15 people are in hospital and 3 now in critical care or ICU. We have no new deaths to report in the last day. Our total remains at 189 people who've died from COVID-19, and 2,789 people have now fully recovered. Earlier this morning, we presented some information around one of the research projects that we have been talking about on and off over the last number of months, and that's our sero survey that was done here in British Columbia. Every day we have learned more and more about the virus, about our ability to protect ourselves, and about disheartening social effects that this pandemic has had. This sero survey helps us understand the impacts that the COVID virus has had on people in British Columbia. And this is a project that we funded through the Michael Smith Foundation for Health Research early on. Researchers at the BC Centre for Disease Control, particularly Dr. Danuta Skowronski, Dr. Mel Krajden, who leads our lab there, and a team at both BC CDC and UBC. As well, Life Labs has been involved in this project. This was the first report of its kind released here in Canada and gives us a sense of the impact that this virus has had in our community. The important part of the report shows that we have been very effective of flattening our curve here in British Columbia. The way that this protocol was run, we received 1,000 samples from a community laboratories across the Lower Mainland, which was the area where we know we've had the most cases of COVID-19. So this is the highest risk area in the province, and those were tested at 2 different time periods to give us a sense of the progression or snapshot of the progression of the virus in our community. It is people who live in the community, so it doesn't take into account people who are in long-term care homes, but we have it across 10 age group bands across the age span in our community. What this does tell us is that there was very little circulating virus in March, which is what we would expect. And then later on, after our peak in May, when we did a second snapshot, we had less than 1% of people who had antibodies in that snapshot. What this also tells us is that we have done a good job of preventing community transmission in British Columbia. And outside of the Lower Mainland, we would expect these numbers to be even less. We also are able to estimate how many people might have had infection that didn't have a test, particularly during that period in March where we had limited access to tests and where our testing strategy really focused on those who were at highest risk of this virus. As you will recall, there were hundreds of people and thousands of people who were coming back to British Columbia in March from many places around the world, and they brought their risk with them from those places, and many of those people did have milder forms of COVID-19. So our estimations are that about 8 times more people than tested positive in this serosurvey likely had the virus in British Columbia, which gives us around 16,000, 17,000 people who may have been infected over the period of the last 6 months. This is in keeping with very similar studies that have been done in other places around the world. So this tells us that we still have very low levels of this virus. And we don't yet know whether having these antibodies means that you're protected, that you're immune from this virus if you get exposed to it again. Those are other studies that we are participating in and leading both here in Canada and internationally to help us better understand. But it does help us know how many people might have antibodies at this point. So we're learning a lot. There's much, much more for us to continue to understand. And the thing that we need to remember is that most of us do not have antibodies to this virus. We have not been infected, and we need to keep doing the things that we're doing to minimize the effects of this virus in our communities. I also want to just mention that the media have done a fantastic job, I believe, of helping us ensure British Columbians, people in BC, have the best information that they need to understand how to best protect ourselves, our families, and our communities from COVID-19. If you have questions about COVID-19 and are looking for guidance, go to the BC CDC website. There is a lot of information there, and it is your first point of contact, your source of truth for the information that we have around what you can do here in BC. The latest information is available, and all of our numbers, the dashboard that's available on that website every day. For non-medical information, 7 days a week, you can call 1-888-COVID-19. And of course, for health questions, there's always 811.